Bismillah Rahman Rahim. Assalamu alaikum. Dear colleagues and PGs, we are discussing chronic hepatitis C. Till now, we have discussed structure of hepatitis C whereon its life cycle, the burden of the chronic hepatitis C, the natural history of the chronic hepatitis C. Today, we shall discuss the HCV treatment landscape, that how the treatment options have changed over time. Days are gone when the treatment was only interferons, either the standard interferon or pegylated interferons. Then it was a combo, the interferon and the DAAs, and now it's the all DAAs options for the chronic hepatitis C. In this video, we will see how this treatment has evolved, and during this evolution, what progress has been made and what are the targets for these treatment options. So, discussing the HCV treatment landscape, in Pakistan, till 2014, it was interferon which was the available treatment for patients with chronic hepatitis C. Globally, in 2011, the first generation of the DAAs, they were introduced and they were used for the genotype 1. In Pakistan, the genotype 1 is very rare. And secondly, because of the cost reasons, we were sticking with the interferon, the standard interferon and the pegylated interferon. Then for the next 2 years, 2015 and 16, it was interferon and DAAs, the first generation were not available, but then the soft riba with or without interferon was the treatment of choice for our patients in these 2 years. Then later on, from 2017 onwards, we switched to the all DAAs. The first addition to the soft riba was the ledipsor, and after that was the Dacla, and now the soft Velpa. This is important to understand that one reason was not to be embarking on the DAAs was the very high cost, and when the soft price was on the compassionate price when it was available to Pakistan, then this opened the window and this opened the gate for the local farmers as well, who come up with the different options. And now probably the DAAs Pakistan is a country where the price is extremely low and very cost-effective options are available for this hepatitis C. So the interferon till 2014, then for 2 years or 3 years, it was interferon and DAAs, and now from 2017 onwards, this is the DAAs in our treatment options for the hepatitis C. I already discussed this slide with you in the when I was discussing the life cycle of the hepatitis C, that when the hepatitis C virion enters the hepatocytes, this yellow is the hepatocytes, it encodes itself, the genome comes out, and this is the genome which has got the 5 non-translational end and the 3 non-translational end, and in between are the different structural and non-structural proteins. The most important components is the NS3/4A non-structural protein, the non-structural protein 5A, and the non-structural protein 5B. And then when it encodes, it undergoes 3 main steps. The first step is that of translation. The second step is that of replication, and the third step is that of assembly. So the translation is initiated and it is controlled by the NS3/4A. The replication is because of the NS5A and NS5B, and the assembly is because of the NS 3. The different available DAAs, they inhibit the translation and replication and assembly via inhibiting these sites. So the NS3, 5, and NS4A, NS4A inhibitors, they will they will inhibit the translation process. The NS5A inhibitors, they will halt the replication as well as the assembly step of the HCV life cycle. And NS5B inhibitors, they will again inhibit the replication process. This is important that all these drugs at the end they are having the words Previr, Asver, and Buvir. Vir is common in all these three names. Vir is common in all these three names. I have shown here in the red. So these are common in all these. And the NS3, NS4A inhibitors, they are having the Previr. Previr at the end of their names, it will be Previr. And NS5A inhibitors, it will be Asver. And the NS5B inhibitors will be Buvir. So all these molecules, their names, they are the last part, the last names, they tell that which group these drugs they belong to. Let's see what are the groups drugs available in these three categories. As I said, this is the genome of the HCV virus. This is the 5 non-translational region and 3 non-NTR. And in between, these are the structural proteins and the non-structural proteins. This is the NS3, 4A protease inhibitors, which blocks the translation. Then the NS5A inhibitors, they blocks replication as well as assembly, while the NS5B inhibitors, they blocks the replication. And this is, I have told you how they do it. The NS3, NS4A inhibitors will block the translation, shown here in the green color. Then the NS5A inhibitors, they will block the replication as well as the assembly. So they blocks replication as well as the assembly. And the NS5B inhibitors, they will again inhibit the replication. So replication is inhibited by two sets of drugs. One is the NS5A inhibitors and another is the NS5B inhibitors. And this is the drugs available in these groups. I told you that the NS3, NS4A inhibitors, protease inhibitors, they are having the last component is Previr. Vir is common in all these three drugs, and they are having the Previr. And you see, Sim-Previr, Isuna-Previr, Pereta-Previr, Pereta-Previr, Vuxela-Previr, and Glecaprevir. Vuxela-Previr is the available options nowadays, and Glecaprevir is the another option. So all these protease inhibitors, they are having the last name of their last part of their name is Previr, 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 and the Vir is common in all these three, and Previr is here. Then coming to the NS5A inhibitors, I told you that they are having the Asver. Asver at the end, the last part of their name is Asver. So the Ledepasver, Ambetesver, Decletesver, this is available in Pakistan. Elbesver, Velpetesver, this is what is in the Sofel combination, and Pybrentesver, which is in the GP combination Amevret. So you see the Ledepasver, Ambetesver, Decletesver, Elbesver, Velpetesver, Pybrentesver. So if the last part of the name is Previr, it means protease inhibitors. If the last name is Asver, it means the NS5A inhibitors. And if the last name is Buvir, it means it is the NS5B inhibitors, the Buvir. So you will remember so in the NS5B inhibitors, which blocks replication, these are either nucleoside or the nucleotide. The nucleoside, the nucleoside and the non-nucleoside, the nucleosides, they are the soft sofosbuvir, and the non-nucleoside is the decibuvir. This sofosbuvir, the site of action is the fingers part of the HCV genome, and the non-nucleoside, the decibuvir, is the thumb 1, thumb 2, and palm. So this is the different molecules available in the different groups. So I repeat once again that remember these three words: Previr, Esver, Buvir. If it is Previr, it means protease inhibitors. So Previr will be coming in the last part of the names of the protease inhibitors. Then Esver will be the NS5A inhibitors. You can remember this, Esver, NS5A. So AA is common here. You can just remember it. And Buvir, the NS5B. So sofosbuvir and decibuvir. So this is the way their names are given, and these are the different options available. Currently, the options available worldwide, mostly these are the oxaliprevir, glecaprevir, velpatasvir, and this biprintasvir, and the sofosbuvir and declatasvir. This is the evolution of the options of the HCV over time. In 1991, the interferon was introduced, was approved for the treatment of hepatitis C, and this, the red line, the interferon remained the treatment of choice in the world till 2011 and even 2014. In 2014, the options, the oral options were introduced, and then it is no more used for hepatitis C. So interferon has enjoyed a long time of being in the therapeutic armamentarium against hepatitis C. In 2008 and 9, the ribavirin was added into it, the blue line, and till 2020, the ribavirin has enjoyed a good reputation of as an add-on therapy for the chronic hepatitis C. Even today, in the difficult cases, we do use the ribavirin. Then in 2001 and 2, the pig-islet interferon was introduced, and it remained again the treatment of choice for quite 2018 and 19. This is the way the drugs they were discovered, and they remain in the treatment options for the hepatitis C. Interferon, the red one, then ribavirin, and then pig-islet interferon in 2000. This is the years 1991, 92, 93, and this is the time it comes. Then in 2011 and 12, the boceprevir and leprevir, they were introduced, first generation of DAs for genotype 1, but then they were replaced by the other agents. That is, the semaprevir was in the 2014, sofosbuvir then the hormone A, ledipasvir and sofosbuvir combo, then Vicaria peg combo came, and then the declatasvir, then the Tecnivir, Zepitavir, Epclusa, Vosivi, and Mevret. So this is the way the drugs were introduced by the companies, and they are being used. And nowadays, these are the last generation of the DAs. This is the timeline when they were introduced, the DAs. On May 13th, 2011, boceprevir was approved by FDA for the treatment of HCV to be used in combination with pig-islet interferon alpha and reba in adult patients. Then on the same month, 23rd May 2011, telaprevir was approved by the FDA to be used in combination with pig-islet interferon alpha and ribavirin for treatment of HCV infection in adults in genotype 1. Then in 2013, in November, semaprevir was approved by the FDA to be used in combination with pig-islet interferon alpha and ribavirin in combination with sofosbuvir. Then in December 2013, the same year, sofosbuvir was approved to be used in combination with ribavirin or with pig-islet interferon and ribavirin. In October 2014, ledipasvir and sofosbuvir combination were approved by the FDA in one tablet, especially for genotype 1 and genotype 4. In December 2014, this was in October, the FDA approved a combination of ambetasvir and the pretaprevir and ritonavir and decibuvir for the treatment of patients with genotype 1. In July 2015, the declotesvir was approved to be used with sofosbuvir, and another combination of abemaciclib, penetrapivir, and ritonavir in one tablet to be used in combination with ribavirin for treatment of HCV genotype 4 patients. Then in January 2016, the 28th January, the FDA approved a combination of elbesvir and grazoprevir with or without ribavirin for treatment with genotype 4, which is more common in the Egypt. And in July 2016, this was January, the same July 2016, a combination of sofosbuvir plus velpatasvir were approved with or without ribavirin for treating adult patients in all genotypes, and the brand was the Epclusa. And then in 2017, sofosbuvir, velpatasvir, and oxaliprevir, that is the OCV, was approved by the FDA, and in the same year, the glecaprevir and piobrentosvir, the Mavorate, it has been approved by the FDA to be used in patients with hepatitis C. Remember, the latest editions of the DAAs, they are pan-genotypic and they don't need the genotypes to be checked and to be given for specific genotypes. This is the response rates of all genotypes. And what we see in the initial years when it was the interferon, standard interferon, and then the ribavirin was added, as the time goes on, the blue is the normal level with treatment naive. The response was gradually increasing. This is the normal level with treatment experience. And here in 2014, we considered a cirrhotic patient as well for the treatment. Initially, we were excluding them for the treatment because of the side effects of the interferon. And from 2014, when the DAs came, then they were also being used. And now what we see in 2020, that the SVR is almost touching 100%. Initially, it was less than 20%, then gradually increasing. And now when the DAs has come, the response is really unbelievably almost 100%. So this is the different trials which on the basis of which the registration of these DAs was given. I'll be just mentioning their names for those who are interested and who want to go into detail of that. At least 95% of efficacy for soft riba. The valence was a study and it was conducted in genotype 2 and 3. And the Busan trial was conducted in genotype 2 and 3. And we conducted from the whole Pakistan the RECEPT trial, and we presented this trial in AASLD, and it was conducted in all the genotypes 1 to 6. It was the ribavirin and SOF versus ribavirin, SOF, and pegylated interferon, and we presented our data. The SOF ledipasvir with or without ribavirin, the IN 1, 2, 3, 4 studies, they were conducted in genotype 1. Solar 1 study was conducted in genotype 1. The Synergy study was conducted in genotype 4. And these were the trial on the basis of which the approval was given by the FDA to be used in hepatitis C patients. The soft decla with or without ribavirin, the Ali1 was for genotype 1 and 3, the Ali2 for genotype 1, 2, 3, 4. For genotype 3, the LI3 study was conducted trial, and LI3 plus for genotype 3. These are the different trials on the basis of which their approval has been given. Remember, the RECEPT trial was not the trial on the basis of which the approval was given. This was the real world data in Pakistan, in which we presented. So it was these two trials, the Valence and Busan, which were used. The data was used for approval of the SOF and riba, and these were the phase 3 trials. The SOF with or without riba, the Estral 1 for genotype 1, 2, 3, 4, 5, 6, 1, 2, 4, 5, 6. Estral 2 genotype 2, Estral 3 was for the genotype 3, and Estral 4 were the genotype 1 to 6, but they were the advanced decompensated cirrhotics, P class B and C. These are the trials, the registration trial on the basis of which the SOFWEL with or without riba registration was allowed. For SOFWEL, Voxivi, the Polaris 1 and 2 for genotype 1 to 6, Polaris 3 for genotype 3, and Polaris 4 for genotype 1 to 4. For GP, the glecaprevir and piobrentosvir combination The expedition trials, they have got different trials, 1, 2, 3, 4, and different trials were using different genotypes. So all the genotypes were tested. Similarly, the endurance trial is different parts 1, part 2, part 3, and the surveyor trials, again the different parts. So these were the trials on the basis of which the GP registration was given. So, dear colleagues, today we just discussed how the treatment evolution has happened over years, starting from the interferon, stent interferon monotherapy, then the stent interferon with the riba combination, then the pegylated interferon and riba combination, then the initial DAs, the telipravir, boceprevir with the pegylated interferon combination, then semipramine with pegylated interferon, and then all non-interferon options. And now we are dealing with the non-riba options as well. So I stop here, and we shall discuss the further aspects of the HCV treatment in the coming videos. Till then, Khuda Hafiz, goodbye.